can you combine surgical and non-surgical treatments for your desired outcome? I'm Dr. Angela Sturm. I'm a facial plastic surgeon, and a lot of times this is what people do. And if you think about anti-aging in a global, longer-lasting perspective and having a 1-year, 5-year, 10-year goal, that's what you're going to do. Because there's not really this, oh, you have one surgery and that's it and you're done and you don't ever have to do anything again. If you have a facelift, yeah, are you going to look 10 years younger? Yeah, that's the idea. And is it going to last you for the rest of your life? Basically, it doesn't stop aging, but you will always look younger. You'll always look better. So could you do that? Absolutely. If you're like, that's what I want to do and I don't have my turkey neck anymore and I'm happy, you can absolutely do that and you will look younger than your stated age for the rest of your life. But if you're that person that you're like, I want to always kind of look young and fresh and better, and this is going to be a combination of things. Facelift is wonderful and it addresses, like I said, the turkey neck, the extra skin, the skin along the jawline. But what it doesn't address is the skin texture and the skin quality. And I think there's a lot to be said for a youthful appearance to your skin. So that would be like your skincare routine and getting with a good person to come up with a skincare routine that works for you and works for your skin. And it's something that you can do every day. It's not a 12-step routine. If you're not a 12-step routine person, to keep your skin looking hydrated and plump and youthful. There are also lasers that can help along with that. And so a lot of times people will do a facelift and they'll do something more invasive like a CO2 laser at the same time because they have the same downtime, and that it's a great time to take care of brown spots and fine lines and wrinkles and all of those kind of things and just do it all at the same time. But for lots of people, they'll do the facelift and then later on they'll do a laser for brown spots and maybe later something a little bit lighter for the wrinkles. If they're not too bad, there's a lot of things that you can do in office just to help keep your skin looking good and skin looking nice and smooth. And the in-office things have a lot lower downtime. So for many of them, you can do it on a Thursday, Friday, and by Monday, you're ready to go back to work or social activities or anything like that. And there's no surgery that helps the lines between your brows, on your forehead, and around your eyes yet. We have tried pretty much everything. People will ask for brow lifts and for eyelid lifts, trying to get those better, and Botox is the only thing that works. Botox, Dysport, any of those medications. Let's say you do a facelift and you still have those lines that bother you, you'll still have to do the neurotoxin, the Botox. You do a brow lift, you'll still have to do the Botox. I've had people want to do a brow lift in CO2 to make the skin nice and smooth and lift the brows, and it works and it does great, but your muscles still continue to move. We have tried a bunch of different things, trying to zap those little nerves, try to freeze those little nerves, try to do a bunch of different things to make them not as strong to make those faces, and they always come back. They're very resistant. There's lots of redundancy in those nerves to make those muscles come back. So since there's not anything really permanent for that, you would always need to combine your Botox with whatever else you're doing, the surgery or anything else. And so it's a really nice combination to have the surgery and then maybe have some skincare and some lasers to make your skin look good, and then over time do the Botox. I have lots of people that have had a facelift years in the past, but maybe they're starting to see a little bit of the lines around their mouth or some of the little sagging around the jawline, and you can do a little bit of filler just to help fill those in. You're not yet at the point where another facelift is going to be worth it, but you're starting to see a little something. So you can kind of help fill it in, help lift things up, with these easier things to do until you get to the point that you're like, okay, maybe it's time again. And some people, every 10 years, that's what they want to do. And other people, it's a one and done. So it kind of depends on the person, what you're looking for, but they really do work well together, the surgical and the non-surgical options, just to make you look really good and then keep you looking really good for now till as long as you want to do it. And my patients go all into their 80s, mid to late 80s. So steal a line from one of my male patients all the time that he said, I have a car, I change the oil, I put gas in it, I wash it, I take care of it. Why would I not take care of myself and my face? That's way more important than that car. And I'm like, absolutely. It's taking care of yourself and making sure you feel good and feel your most confident. So take care of yourself and your face, and let me know if you have any questions. You can find me at www.drangela.com or Beauty Unveiled, wherever you get your podcasts.